Welcome everyone to Mayo Clinic Q&A. I'm Dr. Sanj Kakar. Today we will get a first-hand account of battling COVID-19 from a physician right here at Mayo Clinic. Joining us to share his story is Dr. Deepi Goyal, Regional Chair of the Practice for Mayo Clinic Health System. Thanks for joining us today, Dr. Goyal. Dr. Goyal, you look great. How are you feeling?
Feeling good. It took a while, but really feeling good now.
Looking back, how did you contract COVID-19?
Our, early 20s daughter is living with us this year and working outside the home. And despite her employer's best efforts to, encourage masking, et cetera, she contracted COVID about the third week of July, started developing symptoms, immediately isolated from my wife and myself, got tested positive, quarantined in a room. And my wife and I were then in quarantine for, I believe it was 10 days. On day 9, just when I could see the light, I started developing fevers, muscle aches, and fatigue, got tested, was positive, and then again quarantined, for my duration.
So you were all living in the same house at the same time?
Yeah, we were all in the same house, and really we were meticulous about quarantining and keeping her very separated from my wife and myself. And so I was very surprised when I developed symptoms. My wife, on the other hand, despite being exposed to 2 household members, never developed symptoms, and never was actually tested and never tested positive.
And so obviously with your quarantining in place, tell us the logistics of how that actually happened. 3 of you in the same household. How did you try your best to ensure that you didn't sort of see each other in that way?
We have space in our house where we have a bedroom with adjacent bathroom for, we have 2 setups like that. And so it wasn't hard to find the space for us. I think the logistics, around having, your entire household housebound in terms of getting groceries, supplies, etc. So we were grateful to have friends and neighbors who were really very helpful in helping with that. The other thing is, a cooler was very helpful outside my room, so that I could have access to, snacks and drinks, etc., when I needed them without having to expose other people. And then lots of wipes.
But what about the day-to-day practicalities, for example, of making a meal? How did you do that?
I was grateful to have my wife be able to do so. Fortunately, she made enough food that then my daughter, who's now working from home, despite being cleared and fully back to normal, was able to really help out and make sure I was taken care of.
So you alluded to a little bit about your symptoms. Can you tell us about how your symptoms started and just during the course of your the illness of what you felt like?
It started with a relatively low-grade fever, probably 101, pretty significant muscle aches and fatigue. And those were the majority of my symptoms. I developed some shortness of breath about 3 or 4 days into it, but never severe shortness of breath. I will say the remote monitoring program here was phenomenal. So I had a pulse ox, so I checked my pulse ox twice a day, and it did cause a little bit of panic when it decreased one day, but never got severe. I had about 4 to 5 days of sleeping about 13 to 15 hours a day. And then after that, just, gradually improving fatigue. Really took about 3 weeks, slightly more than 3 weeks to resolve. So the duration really surprised me as well. And then the other thing I'll say is that change in taste and the impact that had on appetite and the appeal of food. So trying to maintain intake and calories was a little challenging.
Did you notice that change in taste straight away, or did that come on slowly?
No, it came on about day 3 of symptoms.
And then you mentioned the remote monitoring program. Can you tell us a little bit about that?
What a wonderful program that is. So they sent a pulse ox and a thermometer, and then twice a day, information on symptoms and vital signs are entered into your portal through an app. And anything that changes or if there are new symptoms, the group immediately calls, checks to see how things are, see if there needs to be any escalation in plans. So really, from a patient standpoint, it really provided a lot of reassurance around where I was in terms of the severity of this disease and the fact that I had access to care.
And you mentioned the pulse ox. Now, that's a monitoring device that you put on your finger or your ear to monitor your oxygen saturations, correct?
That's correct. And that's, because the lung symptoms of COVID can be severe and can cause pretty severe pneumonias.
So you mentioned about the duration of symptoms. What else surprised you about this experience?
So the duration and the fact that it really knocked me down for about 3 weeks. That's the first time an illness has really done that. And I'm a pretty healthy individual. So I can only imagine for people with pre-existing conditions, just how significant an illness this can be, especially if they were to develop some of the other longer-term complications like myocarditis, which is an inflammation infection of the heart. This really is truly very different from a lot of the other viral illnesses we've encountered, like the common cold or the flu.
And obviously, as a physician, but also as a patient now, what advice do you have for people listening to this?
The advice I'd have is really twofold. Number one, really follow the guidelines in terms of quarantining. I think that by immediately isolating ourselves, quarantining, even though I contracted COVID in the household, we fortunately didn't spread it to any coworkers or any patients because we were very strict about quarantining immediately. The second piece of advice I have is develop a plan for how you're going to quarantine ahead of time, especially as kids are going back to school and there's the potential to see rises in the number of cases. I think it would be very helpful for people to have a quarantine plan in terms of the logistics, coordinating with neighbors, identifying space, so that when, if an individual from the household has to quarantine, you have all those pieces laid out ahead of time.
Deepi, anything else you'd like to add?
It really emphasizes the importance of what we're doing in terms of, masking, distancing, hand hygiene as a society right now. The severity of this disease is pretty significant, and I really do think that we're doing the right things. That said, we're not going to succeed and be able to open up the economy and do the things that we want to do to get back to normal unless everyone really adheres to these. So we all want the same thing, and I think it's just incumbent on all of us to do our part to adhere to the masking, distancing, hand hygiene guidelines, and quarantining when the recommendations tell us that it's right to do so.
Our thanks to Regional Chair of the Practice for the Mayo Clinic Health Systems, Dr. Deepi Goyal. Thanks for being with us today, Dr. Goyal.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.